Hello everyone, I am Dr. Bharath Kumar Surisetti. I am a consultant neurophysician and movement disorder specialist at Yashoda Hospital, Malakpet. Parkinson disease is characterized by shaking of hands, face and legs. It is also associated with slowness in activities of daily living. It is also associated with difficulty in speaking and difficulty in walking. So, our patient presented with Parkinson disease symptoms for the past 5 years. He has motor fluctuations in which he goes into severe off periods in which he is unable to move, unable to carry out his daily activities. In this patient, we tried an advanced level of treatment which is apomorphine injections. Apomorphine injection, it is a subcutaneous injection. After giving the injection, when compared to the off and on period, the patient showed excellent improvement in terms of walking and also decreased shaking, improved speech and improved facial expression. So to conclude, apomorphine injections, these are an advanced level of treatment which can be used in Parkinson disease, which will reduce the disability and helps in day-to-day activities. Thank you.